Welcome guys, welcome once more to another YouTube video. I'm doing something on the management of endometriosis, right? The first episode I did about the general overview, the signs of endometriosis. The second episode I talked about the causes and the predisposing factors. What can lead you to, what can predispose you to endometriosis, right? So this final episode I'm doing about the management, the solutions. How can you solve it, right? Yes, it has occurred. You have it, right? How can you move forward? How can you go about it, right? How can you solve it, right? So before I do something on management, let me mention something about complications, right? What are the complications of endometriosis? So one main complication of endometriosis is infertility, right? Infertility, right? I mentioned something that in 40 to 60% of people who have endometriosis, 40 to 60% of them are infertile, right? 40 to 60% of people who have endometriosis are infertile, right? They cannot conceive, right? Yes, they cannot give birth, right? 40 to 60%, right? So again, don't bend down to this kind of narrative that if you have endometriosis you cannot give birth, right? This 40 to 60%, right? So we still have another 40% on top, right? So maybe you can find yourself among the 40%, right? So you can give birth when you have endometriosis, right? But 40 to 60% of them are infertile. So for you to become pregnant, the ovaries must release the ovum or the egg, and the ovum must meet with the sperms in the oviduct, right, for fertilization to take place, right? So what happens in endometriosis, for example, if the growth is on the oviduct, right, there's a high likelihood that the endometrial growth will block the ovum or the egg from meeting the sperms, right, and fertilization may not occur or will not occur, right? That is one way that endometriosis can cause infertility. Another way, the endometrial growth can destroy the ovaries or it can destroy the sperms, and fertilization may not take place, right? So one main complication is infertility, and this may cause you a lot of problem, may cause you a lot of stress, right? It's very difficult. It's a very difficult period, right? So it's one of the main complications. So there are some solutions, right, to this. I'll mention them later, right? So that's one complication of infertility. Another possible complication is cancer. Cancer. So endometriosis can predispose you to ovarian cancer. It can predispose you, right? It increases the risk of ovarian cancer, right? Or it can predispose you to what you call endometriosis associated adenocarcinoma, right? So it can predispose you to either ovarian cancer, or it can increase the risk of endometriosis associated adenocarcinoma, right? So those are two main complications of endometriosis. It can lead you to the ovarian cancer or the endometriosis associated adenocarcinoma, or it can cause infertility, right? Yes. So I've mentioned that. Let's mention something about management. How can you manage it? How can you go about it? You have endometriosis, right? Maybe your sister, maybe your mother, maybe your aunts, right? So you are handling. How will you go about this kind of situation? First, you need to really see your doctor, right? Don't go about buying medication over the counter, right? See your physician, see your healthcare provider, consult with him or her, right? He or she will get the right diagnosis and will give you the right way to treatment, right? So how can it be managed, right? First of all, we say that endometriosis presents with a lot of pain, right? It can be pain during urination. It can be pain during bowel movements, right? It can be pain during sex. It can be pain during menstruation, before menstruation, during menstruation, even after menstruation. So it presents with a lot of pain, right? So we really need to manage this pain, right? So the first priority will be we manage pain, right? So managing pain, we have different drugs, we have different strategies of managing pain. Some of them is you can use what we call the NSAIDs, the likes of ibuprofen, the likes of naproxen, right? There are a lot of pain medication. Again, don't just go to the any pharmacy or maybe to any chemist or over the counter and buy this kind of medication, right? Consult your physician. Just go to a healthcare provider. She will recommend the right medication, right? The right pain reliever, right? The right pain medication. So we have the likes of ibuprofen, the likes of naproxen, right? Again, you can manage pain. Let's say this kind of pain it has occurred. Sometimes it can happen when you are indoors, you are in your house, maybe at 2 a.m. in the night, maybe at 3 a.m. in the night, right? You can manage it at home, right? As you wait, maybe for the right time to go to the healthcare facility, right? You can use heat therapy. You can use hot massage. You can use home massage, right? Or cold. Some people can use maybe cold compress, right? So you can use a home massage to relieve the pain, right? Maybe when the pain has occurred, maybe at 2 a.m., maybe you are not near an hospital setup, maybe, right? So you can manage it also at home using maybe the home massage, the hot compress, things like that, right? So the first priority is managing the pain. Pain comes in a lot of ways. You have difficulty urinating, you are feeling pain, you have pain during bowel movement, you have pain during urination, you have pain during menstruation, right? So the first priority is managing that pain, right? After that, we have hormonal treatment, hormonal therapy, right? So there are kind of hormonal treatment that are used to shrink the endometrial growth, right? Their main work is to atrophy, to cause atrophy, or to shrink the endometrial growth, right? So hormonal treatment is one of the key treatment strategies, right? So we have different hormonal treatment. We can use there are different family planning methods that can be used. There are kind of different hormone treatment that can be used, right? So the first one we have something called combined oral contraceptives. They can be used to cause shrinking or to cause atrophy of the endometrial growth, right? The combined oral contraceptives, right? Again, don't just walk into an health over the counter, maybe to a pharmacy and buy this stuff, right? Consult first, right? So we have combined oral contraceptives. Apart from combined oral contraceptives, we have something called gonadotropin releasing hormone agonist, right? Gonadotropin releasing hormone agonist, the likes of leuprolide, right? They can be used to cause shrinkage or to suppress the growth of endometrial tissues, right? So apart from hormonal, there are different hormonal treatment. Your physician or your healthcare provider will give you the right treatment, right? So just visit the healthcare provider, consult with him or he will give you the right hormonal treatment, the right pain medication, right? Apart from pain medication, hormonal treatment, there's a situation where you will need surgery, right? So apart from the hormonal treatment, apart from the pain medication, right? There's a situation that you may undergo fertility treatment, right? So we have different fertility treatment. Maybe you really want to become pregnant, right? But endometriosis has caused you to maybe fail to conceive. You are in marriage maybe 3 years and you cannot conceive, right? So there's different fertility treatment, right? The likes of in vitro fertilization, right? IVF, in vitro fertilization, right? Again, your healthcare provider will give the right fertility treatment, right? After consulting with him or he will give the right way of treatment, the right fertility treatment, right? So apart from pain medication, apart from hormonal treatment, apart from fertility treatment, right? This kind of treatment may fail, right? And we may need surgery, right? So under which conditions do you need surgery, right? So you need surgery when maybe you have severe severe endometriotic symptoms, right? That are responsive to hormonal treatment, right? So the healthcare provider may have tried hormonal treatment, but it has failed, right? You may need surgery as the only solution, right? So another situation where you may need surgery is when the endometrial growth is greater than 1 centimeter. The tissues have grown to greater than 1 centimeter. You definitely will need surgery, right? Yes. So we have two types of surgery, right? We have conservative surgery and we have definitive surgery. So what is conservative surgery? In conservative surgery, let's say for example you are new in marriage, maybe you have given birth maybe to only one child and you are planning maybe to have 3 or 4, right? Or maybe you have not given birth at all, but maybe you want to give birth. You may be taken to something called conservative surgery, where the physician will only, the healthcare provider will only, or the surgeon will only focus on the growth alone, without interfering with any part of your body, right? You will only remove the endometrial growth alone, right? So that's what we call in conservative surgery. You are not yet finished with giving birth, you are still planning to give birth, right? So we cannot, the healthcare provider cannot remove the uterus, cannot remove the ovaries, cannot remove the ovula. So we'll undergo something called conservative surgery, right? For example, laparoscopy, right? So the focus here is only to remove the endometrial tissue alone, nothing else, right? So apart from definite conservative surgery, which I've said that just focuses on removing the endometrial growth, right? We have also definitive surgery. Definitive surgery, what is it basically? So this is when the endometrial growth has gone to an extreme extent. Yeah, the growth is very reached maybe to the final stages, right? You have given birth, like you feel that now you have enough children, maybe, like, right? So this is when now the hormonal treatment have failed. Maybe the conservative surgery has also failed. You have a full family. You have you feel like you have enough children. Don't want to give birth again, right? And the symptoms are very severe. The symptoms of endometriosis are very severe, right? You may undergo something called definitive surgery, right? So here, the physician or the surgeon may decide to remove, you and the surgeon will decide, the two of you, right? To remove the uterus, maybe to remove the ovaries, the two of them, or to remove the ovula, right? So you may undergo removal of the uterus. So what we call hysterectomy, right? So what can this help you with? For example, the removal of uterus alone, hysterectomy. So you will no longer have painful menstruation, right? You will no longer have heavy bleeding, right? So when the benefits outweighs the risk, right? The benefits outweighs the risk, right? So the doctor, you and the doctor may decide, right? So let's, for example, let's remove the uterus, or let's remove the uterus plus the two ovaries plus the oviducts, right? So what we call hysterectomy with bilateral salpingo-oophorectomy, right? So you remove both the uterus, you remove the uterus, remove both the ovaries, remove the oviducts, right? And this may help to solve a lot of complication of endometriosis, right? But again, there are side effects of this kind of surgeries, right? So one of them is maybe early menopause, right? You may be predisposed to early menopause. You don't have the body is not producing estrogen. You don't have the progesterone. It's that kind of hormones, right? So you may experience early menopause, right? So in many cases, surgery is always the end goal, right? But again, there are hormonal treatment, there are fertility treatment that your physician will tell you. There are pain medication that can help you solve a lot of pain, right? Because it prevents a lot of pain, right? But now surgery will be the end goal. maybe it has reached to a point where hormonal treatment cannot help you. You have given birth, maybe for example, you feel that your family is now full, you don't want to give birth again, right? This is where surgery will come in, right? So I hope I tried to address some of the questions you've been asking, right? So I hope we'll continue interacting. Let's interact in the comment section. Please just take one second. Just take 1 second to subscribe, like and share, right? So let's meet in the next video. The next video I'm going to do something about pain during sex. What happens, right? Of course, there's pain during sex. How can you solve it, right? So that is it for today.